Hello, my name is Annalie Martin, and today I will be going over the stool specimens, which includes the culture and sensitivity, the ova and parasite, the occult blood, and also the 24-hour. So for the stool specimen, you will need a tongue blade, you'll need the clean container, you may need PPE depending on if they have maybe like C. diff, or something that would be more contagious. You need your biohazard bag, and you will also need the label based on the company's procedure. So the first thing I would do is I would want to make sure to verify that order before I walk into the patient, wash my hands, put on the PPE as needed, and I will decide whether the patient will use their bedpan or a commode, or sometimes they have like a little plastic thing that you put in the toilet. You want to make sure to explain to the patient that there is going to be no toilet paper inside. They will also probably want to use they'll need to urinate first, because you definitely don't want any urine in that specimen. So you're going to check. You're going to check the label for the name, the ID, and you're going to want to have the route, and you're going to want to make sure that you have all of your equipment at the bedside. So you will talk to the patient about how they are going to use the bathroom. And if it is in the toilet, then you'll want to make sure to tell the patient, let me know as soon as you're finished. And then you are going to take your tongue blade, and you're going to get some of that. You're going to want to get the stool into the specimen container, and you are going to want to make sure that you perform hand hygiene. That's very important in this. When you're dealing with the stool, you're definitely going to want to make sure to wash your hands, and you're going to want to make sure to document the color, consistency, and the time is also important, because when you send that, that will tell them whether it is good or not. So with the bacteria, like for tests for like a lot of bacteria, like they might be ordered to scan for pathogenic organisms, like bacteria that are associated with enteric infections. So that's a time when they might order that type of test. And with the ova and parasite, that is like toxins that indicate like maybe like C. diff or electrolytes. Sometimes they check for fat, leukocytes. So with the ova and parasite, one thing to keep in mind is they usually want that test to be warm. So that is definitely something that you are going to want to check with the hospital to make sure that that you do that correctly, and with their policy. Now the occult blood testing, that is a very common test to screen for gastrointestinal cancer. They also may do that test for intestinal bleeding. Usually, if it is for colon cancer, they will want 3 samples over several, like 3 to usually like several days. And if they do have a positive test for that, then that is going to indicate abnormal bleeding. So you're going to need your gloves, your wooden application test, just like in the stool specimen, the bedpan, the biohazard bag, and the label. So this test is somewhat similar, but you are going to want to still make sure you check that label, and as always, maintain the patient's privacy. So after the patient defecates, you are going to have a test. So the test looks like this. Like it's not like this, but it's like going to be like a flat test with different spots to put your specimen. So after the patient defecates, you're going to open up the flap, and you are going to use the one side of the applicator to put one amount of the stool specimen, and then the other side to put the other another sample of the stool. So and you are going to want to obtain that from the center of the bowel movement. So then you will close that and send that to the lab for them to check over that. So with that test, that is the FOBT, you will usually send that to the lab. But if they do prefer for you to do it yourself, then you will need to wait about 3 to 5 minutes, and then you will add 2 drops of developer on each window, and then you want to observe that for blue areas. So then there's another test called the FIT test, and that is, in my opinion, very similar in that one you're going to open the flap and you're going to add the stool on the top half of the window, and then you're going to add a second sample of the stool on the second half of the window, and then you will use the applicator to mix and spread the sample over the entire window. Then you will add 3 drops of developer to the center of the sample, and if it is pink, you will record those results. And then with the 24-hour, that is a very common test used to look into fecal fat. You will collect that over 24 hours with a testing kit, and then you would do the same thing with that. You would send that to the lab as well. Thank you.